So latest update on Abdul Hanan. Abusuya ne lawyer Godfred Dame went to me and survive ewo court na asem no very very interesting. And yeah, that's sorry our latest update aba Godfred Dame ebedidi nkomo bebre say ono no oba be site the Attorney General BNI na yoku oba be site say ankofo yi contempt of court cause omo a violate court order. But Godfred Dame no went to me anya bema osanso file application a friend no heaviest couple sa heaviest couple yi eche say court no en order BNI and as a chief justice no on order BNI na eche say BNI en release Abdul Hanan embra court abusuya ene yeda sore ya Godfred Dame lawyer kese a odema NPP lawyer kese Abdul Hanan ne lawyer yi saa heaviest couple application now the cocoa PM court want to me and survive abusuya or the mrika akwa withdraw then and the tertiary amana akwa withdraw sa application I know and I project at the add to your screen no and change at the amamno Godfred Dame withdraws application seeking to compel AG to produce Hanan from court following his release from custody abusuya enti no Godfred Dame and many me ya no wakwa withdraw application na yede ho nsem ebremo na abusuya yɛbɛpɛ sɛ yɛbɛma na makwakuti enseme course answer na yɛbɛkɔ no Ghana ha sɛ open computer papa and a laptop papa na we use the Abura Periodic computers and accessories ho na obenya laptop papa na we use the location enya yira kwan o Kumasi Buokrom Estate Eli peke number na ɛwɔ your screen ya see na toche Periodic computers and a laptop papa fee dia ade ba kwa ede ewo mni se ukra low budget and as a high budget obema high quality laptop na HS we use yembonra yensem ye ba ye de aka beto amoso
using a document his lawyers say has nothing to do with those accounts. Well, if you recall, when the Deputy Attorney General first put out that Hanan Wahab had been picked up on Saturday for trying to travel out of the jurisdiction, trying to access his frozen bank account, his lawyer, I'm talking about the former Buffer Stock CEO's lawyer, Godfred Addo, the former Attorney General, did indicate that, look, I mean, if the account is frozen, then why are you saying he was trying to access the frozen account? Now, what we are getting to know, based on the Deputy Attorney General's account, is that there was an attempt by Wahab, Hanan, to access this frozen account using a document. In this document, I'm going to show you the details as per the Deputy Attorney General's account. The motion is set to be heard July 16. Hanan Abdul Wahab's lawyers are firing back, and we're going to run through the statement that they have put out as well. But this is what the Deputy Attorney General is seeking in this motion that has been filed, is citing alleged attempt to empty frozen bank accounts using misrepresented court order. Republic versus Hanan Abdul Wahab, Alodiba, and that's Pfizer Seidu Wuni, High Court Accra. The motion filed earlier today by the Deputy Attorney General, they're seeking, or he's seeking one, to revoke the leave granted to Hanan on June 29 to travel to London for medical purposes. Two, is seeking a motion, that's the motion that's going to be heard on July 16. And these are the allegations captured in at least the documents that we have seen, that the multiple bank accounts linked to Hanan and associates were frozen under the High Court Orders 2025. This is when this matter began. The Attorney General alleges that after getting the travel leave on the said date of June 29 to travel to London, Hanan tried to withdraw all the funds from the frozen accounts that were frozen sometime in 2025. He also allegedly told Republic Bank the freezing orders had been discharged. And the Attorney General is saying that the document he presented was actually a ruling in an unrelated case about landed property, not bank accounts. And even that ruling didn't discharge anything. He actually just struck out his application. Essentially, what the Deputy Attorney General is making the point that Hanan presented documents regarding a landed property to the bank, allegedly, to Republic Bank, that it was that order that was giving him now the right to access the frozen account. And as a result, the bank grew suspicious. They refused the withdrawal order, and then they alerted the Attorney General's office and the Economic and Organized Crime Office, EOCO. So this is what the Attorney General has presented to the courts, reason why he wants the revocation of Abdul Wahab's London travel leave. On the matter of the medical issue, reason why the courts granted him leave, according to the Attorney General, Hanan's travel leave was granted for a London medical appointment. The AG says his own submitted medical reports show only allergic conjunctivitis. That's his allergies. That's catarrh. Catarrh, which is treatable locally with eye drops. Right? So they're now questioning the basis for that legal leave that was given for medical reasons. That whatever Abdul Hanan Wahab is suffering can be treated locally. And the London appointment cited was a booking with Boots Opticians, a retail pharmacy chain, not a specialist referral. So that's another matter as well that we've gotten to know. That he was just going to, according to the Attorney General's account, going to just get a pharmacy for that matter. He says the AG is also making the point that Hanan has since been rearrested, as we do know, apprehended as a safeguard. The Attorney General is arguing this conduct makes him a greater flight risk than when the leave was first granted because of these developments and the matter of he also attempting to access the frozen bank accounts. Well, his lawyers have not been silent on this account by the Attorney General. They have also issued a statement. And if you recall, Godfred had put to the Attorney General why he was making the point about Abdul Hanan seeking to access his bank account. Take a look at this interview we had with Godfred 2 days ago. I'll read that statement that they have put out as well to you, responding to these issues. Take a look.
We're not given the opportunity to see our client at all. Indeed, we're told flatly that they don't allow lawyers to see their clients on weekends. And that's quite perplexing. I'm surprised. If a person is arrested, say on Friday night or Saturday, he will be in without access to counsel. I mean, that's the republic in which we live now. And indeed, he's been picked up for no reason. As far as someone said, he's just been banded off into custody for no reason whatsoever. He's been given the right to leave the country, to travel to the country for a few days by a court of competent jurisdiction. The Deputy Attorney General himself was in court and argued, and this colleague of mine argued that day. And if indeed he had any objection to the order granted, he only had to appeal, but he had to sort this surreptitious means of preventing from traveling. I think that this is totally unwarranted and unnecessary.
Well, continue. Yeah,
so that's Godfred Yewuadame, lead counsel for Abdul Hanan Wahab. He's issued a statement as well responding to the issue that the Attorney General put out. He says his client has not been shown any evidence of attempted withdrawal by EOCO or BNI regarding the bank account that was frozen. 2, he's challenging the Attorney General to produce a check, withdrawal note, or any proof of the alleged attempt to withdraw funds from the frozen accounts by Hanan in the Republic Bank account, for which they say the bank alerted EOCO and the Attorney General's office. They are insisting there is no valid order currently freezing the accounts, and saying the earlier freezing orders lapsed. 2, that they're making the call that the arrest of Hanan is totally unfair, an abuse of power, and a deliberate scheme to disobey the High Court's own order, asking that he, in fact, give him the leave to travel. And on the matter of the dispute of the bail, they're saying the Economic and Organized Crime Office is now demanding fresh bail conditions, 5 million Ghana cedis, with 2 sureties. They're pointing out that their client is already on court-granted bail and has been reporting to EOCO fortnightly. But they're also making that the calls, the new conditions that have been put out by EOCO itself as outrageous and designed to keep him in custody regardless of the court order. And this is what the next steps of his lawyers will be. They're saying that if he is not released, despite what he calls false charges, his client has expressed the resolve to remain in custody until the court vindicates him. A direct appeal to public, that's judicial sympathy. So we'll see how the coming days will look like on this particular matter. But this is Ghana Tonight. We'll be back shortly after this quick break. Stay with us.
As a member of parliament, you get people coming to you saying that, oh, I didn't go through and I didn't know why I was rejected. I don't know why. And they keep chasing for you to do something about it. So were they actually told that because of this reason, you are not going through and then you better go and change your life or something? Thank you.
Well, in fact, I remember he's here when we were discussing the argument. Let's send them the results. And then I remember, the recent recruitment, we had, I think, about 1,300 or so that were on HIV. And then they said, can you imagine sending somebody a resource, they're telling the person that you have HIV? That's not the procedure. The person has to go through some orientation. So one of the things that we did was simply to say that when you get disqualified, you are given a contact to reach out. If you are interested in knowing the details, then when you call, then they assist you to let you know. Because interestingly, some of the things that we realize are treatable. So people need to know and then also get treatment so that subsequent recruitment they could join. So you need to know it's of interest for every person that got disqualified to be interested in knowing what was the cause, so that at least you'll be able to, those that you can treat, hepatitis B, if you have cardiac issues, maybe you've had some major surgery, drug, mental, and all that. A lot of it, some of them, I believe, you would help you be able to get out of it, especially those who had mental issues. People may not even know that they are having mental issues, but these are things that are easily treatable. So we encourage everybody to try and reach out. Don't just say because you've been discovered, you are no longer interested. Be interested, because it may be something minor, it may be something major, whichever it is. If you get to know, it will be of great interest to them. But the reason why we didn't send the results directly was that we don't want the shock. Even based on the WHO guideline, there are certain ailments, you just don't throw it on the person's face that, oh, you have hepatitis B, you have HIV, you have that. So that was why we didn't send the results directly.
Well, so that's Mohamed Muntaka Mubarak there, the Interior Minister. But the Ghana East Commission, during a media briefing earlier today, explained that this particular figure in context. But you can understand why there's been that reaction from the members general public regarding this 1,300 that's applicants who tested positive for HIV. The East Commission says is 1.3% of the entire figure when it comes to the bigger picture of the HIV and AIDS prevalent cases in Ghana. John Eliasu Mahama is Acting Director, Policy and Planning at the Ghana East Commission. He's joining us on Zoom for a quick conversation on this particular issue, especially because, if you recall, yesterday when we spoke with a security analyst, he made the point that, look, to the extent that if they had gotten into the security services, maybe they wouldn't have been identified or discovered if they got into the service. God, there's a lot that's happening. But, Mr. Mahama, good evening. Thank you for joining us here on Ghana Tonight. First of all, when the Interior Minister put out this 1,300 positive applicants, HIV positive applicants yesterday, you could understand the reactions that came as a result of that information that was put out. But why is the East Commission saying that, look, this is nothing to worry about, and we should be careful that we don't veer into areas that could also increase the stigma against persons living with HIV and AIDS?
Okay, thank you very much. So fundamentally, there are three issues. The first is, 1,300 is put out, even though it also went out with the total number screened over 100,000. The first reaction for many people is that, oh, that's a lot. 1,300 people from this number having HIV. but it just brings to reality, the magnitude of the HIV challenge in the country. And so when you put it into perspective, the national prevalence is 1.49, which is slightly higher. If you use the 1,300 out of 100,000, it comes to just about 1.3%. So it's even slightly lower than the national prevalence. So that's the first issue, that people thought it was alarming, or maybe with these figures, the HIV cases are on the rise. In actual fact, if you look at progress made over the years, the HIV cases have been declining. It's just that they are not declining fast enough. So really, that's the first concern we had, trying to situate it within that context. The second was the issues around stigma and discrimination. The way in which the information was kept out there, it wasn't so clear whether some of those who did not get into the security services were actually not admitted because of, in fact, the full reasons for they not being recruited or being admitted wasn't very clear. But the Ghana AIDS Commission the Ghana AIDS Commission Act actually makes it very clear that HIV status should not be the sole basis for denying people employment, irrespective of which employment. The Act itself recognizes that, different jobs or different areas of work would require different, basically different levels of fitness. And so the true test for us should be about medical fitness to work, and not merely the HIV status of the applicant. So that was the second sort of concern that we sought to raise. And then the third one, we wanted to use that opportunity to emphasize some of the key tenets of the testing protocol in the country, that every testing, the people that are being tested, their consent is very key. It needs to be secured. The data needs to be kept confidentially, and their HIV status not disclosed to any other person. In fact, in this particular situation, the way in which it was communicated, in a way, actually buttresses some of those points. The fact that it was aggregate figures that came out, and the fact that a hotline was provided so that people could call and get additional information if they needed counseling and so on. What wasn't clear is, but I think these are sort of standard protocols in terms of the consent before even taking the sample. So the applicants would know, or should know, that they were doing the HIV test. It shouldn't come as a surprise to them. And also linked to that, so that whole issue around the protocol, because one of the key things is that a single HIV test cannot determine if someone is positive or negative. It may turn out to be reactive, but the standard test in the country is a 3-test algorithm. If the first reactive test is positive, then you have to go to the next stage to confirm, and then a further third stage to validate. So if you haven't completed all these 3 steps, you can't really confirm or conclude that someone is HIV positive, and you shouldn't use that as a basis for your decision. And so, of course, what came out, it wasn't clear to us if these were followed. Of course, being a government agency also, we are in touch with the Interior Ministry, trying to work out the details and trying to really understand, because within the context of how the information came out, perhaps it was a bit difficult, because he was responding to a specific question. The minister was responding to a specific question when he gave out that information. So there definitely will be more details, which we are working to now come to those details. So these were really the 3 key issues that we wanted to bring out.
Right. You make the point that it wasn't really clear if the steps were followed. The 3 steps that you talk about were followed. After that comment yesterday, or the answer given by the Interior Minister to a question asked of him yesterday, has the Commission done any follow-ups to find out if indeed the 3 steps were followed before this applicants who tested positive. And then also, you can understand, the reaction that greeted this statement, right, from the Interior Minister regarding not just persons, but applicants who sought to get into the security agencies. So you can understand why that reaction would come within that context, is it not?
Exactly, and the risk of that fueling the stigma around HIV. We are already in a context where the data tells us that over 70% of Ghanaians have non-accepting attitudes towards persons living with HIV. That's data from the 2022 Ghana Demographic and Health Survey. And so within such a high stigma, HIV-related stigma environment, every communication has to be quite sensitive. So if you put out this information, first is the element of self-stigma. So if I were among the applicants that were not recruited and who were asked to follow up, and I hear this information in the news, the first thing would be, oh, could it be that I also have HIV? We don't know yet whether, as I mentioned, each applicant went through the 3-test algorithm, but even if they did, there should be a way in which they receive this. Because knowing your HIV status is not a simple decision, because this is a condition that if confirmed, you are going to live with HIV. For now, we don't have a cure or vaccine. So for now, it's lifelong. There are medications, you'll be healthy, you'll be okay, but the burden of taking medications every day and dealing with stigma and so on is still heavy. And so these are not decisions that should be taken lightly. So as I mentioned, that's the first element, self-stigma. How will people handle it themselves? Then the second one is the external stigma. So if I had a friend, a relative, and so on, who went for this recruitment exercise and wasn't taken, and then I hear in the news this information is put out there, I would immediately begin to wonder, okay, could it be that maybe it is because of maybe the person has HIV and that is why they were left out. So, there were a few gray areas that didn't come out very clearly.
Okay.
And as I mentioned, the law is clear that HIV should not be the sole basis.
I see, but Mr. Mahama, the Interior Ministry has indicated that they're going to do some follow-ups, right, to communicate, as you indicated, how the results are going to be communicated and so on. All these concerns that you've raised, as legitimate as they are, that they said they're going to find ways of providing counseling, the process to at least communicate the results of this outcome to the applicants. Are you going to, as a commission, also lend some support to the process? Because that's the Interior Ministry. You are clothed with the expertise to do this. So what happens from today onwards between you and the Interior Ministry regarding how these applicants will even get to know that, look, I am HIV positive?
Well, already we have begun some engagement at the leadership level so that we ensure that all the protocols are followed, and of course closely with Ghana Health Service and with the National AIDS Control Program, so that so yes, the Commission is really already taking the proactive steps since yesterday, engaging the leadership of the Interior Ministry in this direction, so that we can assuage the fears that are out there and also the concerns, and not just coming from the Ghana AIDS Commission, but the broader community that we work with, even including the networks of persons living with HIV who have also issued a statement, expressing concerns about stigma and so on.
And maybe quickly, before I let you go, the persons living with HIV, whom you just referenced, they have also put out concerns about the shortage of antiretrovirals and then also the HIV test kits as well. Is the Commission aware of this? What are you doing to address the concerns of a looming shortage of antiretrovirals and then the test kits as they put out 2 days ago?
Well, so really the stock levels at the national level for the test kits and the ARVs, The main concern is that the stock level has gone below the threshold that usually we try to maintain at least a 6 months level of stock. And so once it drops below the 6 month level of stock, we begin to raise the alarm, especially when we look at the distribution across regions and notice that there are some places where stock levels are really low and other places. But anyway, generally with the Ghana Health Service, Ministry of Health, NACP, there are already measures being put in place. We are aware that 2 weeks ago, the AIDS control program put in a request to the ministry for emergency procurement of additional commodities so that we'll avert any stock and any stock outs. And the indications we have is that within the next month we should be receiving additional commodities. Also, even today, there was an emergency meeting to discuss this commodity issue. So there are already some measures that are being put in place to forestall any issue of stock out, because really stocks are very key. Managing HIV in this age, we are encouraging people to get tested to know their HIV status. So the last thing we would want is to experience stock out of test kits or experience stock out of antiretrovirals, because then it will be leading to.
Okay, abusunya we ne ensema so political highway so Godfred Dame na HSL latest update on Hanan no ye de ebrema wa withdraw any application or the koko PMO court enye asem keto akra beda ma sesem je pe ne koko tisa ensem edema aha gossip politics TV so